Again, on the business desk at this hour, we focus on a complaint that has been submitted to the Competition Commission over the excessive price of Covid-19 PCR tests. The Health Funders Association, along with the country's medical aid schemes, are crying foul over this matter, and it's understood that at the start of the pandemic, there was an agreement that the price of these products should be on a cost recovery basis for the duration of the pandemic. Profmed's Chief Executive, Comrie, speaks to us about this matter. Thank you so much for your time. Let's start with exactly what is the basis of the Competition Commission submission that you've made.
Well, the effective basis of the submission addresses the fact that we believe the pathology groups have charged excessive prices when it relates to those PCR tests. We know during the peaks of the pandemic, probably March 2020 through until the end of 2021, the prices had varied, but in the evidence that we've positioned at the Competition Commissioner, we provide the details on how these are excessive and don't reflect the prices that the medical schemes have paid for those tests.
And Craig, how wide-ranging is the evidence that you have that you would be providing to the Competition Commission should they probe this issue?
So as representatives of the members of medical schemes, it certainly is our responsibility to actually make sure that all the funds that are within a medical scheme environment is safeguarded. And so in terms of our claim, our estimates are in excess of R1 billion that needs to be recovered from the pathology groups.
R1 billion is a sizable amount. What happens should the Competition Commission rule in your favor?
Well, that money would hopefully be recouped to the medical scheme environment and will be set off against future claims of the medical scheme membership. I think healthcare in general is expensive and is becoming more expensive in the country, and so we need to do all we can to limit the price increases. And so this will go a long way to limiting premium and contribution increases in future.
On the moral side of this particular matter is the mere fact that in a pandemic it wouldn't be expected that there would be irregularities of this nature. Where do medical aid schemes stand on that particular one?
Well, that was in fact part of the Competition Commission Act. So if you look at the Act, it actually provides the safety net to address areas where there has been excessive profiteering by certain groups. And so in terms of the Section 8 that we're using, we clearly indicate that there has been excessive prices. In fact, part of our complaint would be to unearth and get the costing of those PCR tests a little bit more transparent into the marketplace. We perfectly understand that medical schemes paid a lot for these tests, but we also know that individuals would have paid for the tests out of pocket as well. And so it is a far-reaching engagement with the Competition Commissioner, but our part is only for the PCR tests as funded by the medical schemes themselves.
With regards to maybe consumers that may have bought these PCR tests for themselves, do they also have a role to play in maybe taking the same route that the medical aid schemes have taken? Of course, the onus is not on you to fight everyone's battles in this regard.
Yeah, certainly, I guess our case would lay the foundation for anything like that, but it would be up to individuals to actually take that forward.
I think let's also discuss the issue of the price disparity itself and what would be deemed as excessive in this regard. There's a price tag of around 850 and there's one of around 500 rand. But there was a price determination going into the pandemic that the providers, and here in this case the pathology companies, would toe the line in terms of where a cap would be.
Yeah, in actual fact, those PCR tests before the pandemic would have cost you about 1,300 to 1,500 rand. But because of the volumes that came through the testing environment during the pandemic, that naturally drove a lower price. So the pricing that was paid, the 850 and then the drop to 500, does still not reflect the actual costs and efficiencies that would come through with the volume of tests that eventually came through in the different phases of the pandemic. So it's that variable throughout the stages that we're presenting evidence to the Competition Commissioner that the pricing should have been and should reflect the costs actually incurred.
Lastly, Craig, what outcome are you expecting, and are you confident that you have a convincing case to prove to the Competition Commission?
Oh, absolutely. We think the evidence that we have will clearly indicate the difference in the price and the cost, and that the Competition Commissioner will have the opportunity to rule and provide us with a certificate which we could take to a court and then recoup those costs. We certainly are looking for the recoupment of those funds back into the medical scheme spaces. I mean, medical schemes are non-profit organizations. They only represent members, and so we want those funds for future claims of our medical scheme members.
Thank you so much for your time and your contribution. Craig Comrie is the Chief Executive at Profmed, talking to us about this matter that they have brought to the Competition Commission over excessive pricing of COVID-19 PCR tests.